So Simone Biles is an Olympic gymnast on the American team, and this week she decided to leave the Olympics to focus on her mental health. And I've read various articles and the comments are quite telling. Some comments are very supportive, applauding her honesty in sharing her challenges and putting her own needs first. Others have been quite critical, with the suggestion that these things should be managed in private. Had Simone had a physical injury, I think the response would have been different, with a lot less coverage of her Olympic exit. So I spoke to someone this morning who had been working 10 to 12 hour days for the last year on about 6 hours sleep. Unsurprisingly, this grueling routine had left them with chronic anxiety and constant fatigue. Currently on sick leave, they told me that they'd handed in their notice as they felt such shame about the situation. I wouldn't have believed them had I not done something similar about 5 years ago. So, although we are talking about mental health more openly, the stigma is deeply rooted. I think we need to really continue the discussion and raise awareness. We need to be educating people, in particular children, to care for their mind as much as their physical body from an early age. We all know how important it is to eat well and to exercise often, but there's no expectation set in terms of our responsibility to care for our mind. The frustrating thing is that it's actually quite simple, and just a few techniques carried out daily, along with a better understanding of how our mind works, could make a big difference. So I talk quite often about feelings with my kids. I like to think that if they felt low, that they could tell me as easily as if they were telling me that they had a twisted ankle. So today, how are you feeling? I don't want to hear fine. How are you really feeling? I am interested. I wouldn't ask if I wasn't. So on a scale of 1 to 10, where 1 is despair and 10 is elation, where are you now? If you're anything below a 4, then it's time to get help. I've posted links below directing you to places that you can get help, but have a think about this. Do you have someone close that you can speak to? Can you contact your line manager and let them know? Do you have an employee assistance program, sometimes called an EAP, in the workplace? These organisations will often have some sort of counselling service attached. Could you give your GP a call? There's also charities like mind.org.uk who you can contact for immediate support, and the Samaritans, which are 24/7. You can also contact me, and my contact information is all over my website at clarityatwork.co.uk and in the notes below. So take care of your mind as much as you take care of your body.